long time ago. Long time ago. We're just doing the whole what school you grad from thing. All right, 8:13 right now. It's summertime. You're going to be out in the sun. Dr. Ryan Sato here is a dermatologist. And, okay, so 3.5 million cases of skin cancer every year are diagnosed in the U.S. Did I get that right?
Correct. About 1 in 5 Americans will have skin cancer at some point in their life.
Wow. That's incredible.
That is.
Okay, so what are we looking at? I mean, obviously, we're in a high-impact zone as far as the sun is concerned. So some people look at their skin and they see white spots, or are we being paranoid, or what do we look for specifically?
No, not at all. I always tell patients that you know your skin's best.
Yeah.
So when they come in, if they're concerned about something, that's the best thing to, highlight and bring to our attention.
Okay.
Of course, there is the ABCDEs of melanoma. So if we're looking at a brown spot, if the mold is asymmetric, B border, irregular border, C chain color, more than one color, D diameter greater than 6 millimeters or more, and E is evolution, where if somebody noticed it changing on them, definitely bring it to our attention.
Okay, so you have something over here. Not every dermatologist is going to have something like this, but what is this?
True, so this is a UV light box.
Okay.
What this does is help to highlight the sun damage underneath our skin surface. When we look under visible light, that we can see pigment irregularities and sunspots, but what the UV box is able to do is pick up that sun damage underneath the skin surface.
Okay, so Noel's going to bravely volunteer. And, okay, so get on under there, Noel, and tell us what we're going to see.
So under visible light, Noel is young and dashing and youthful,
beautiful.
Of course. But under the UV light box, we're able to see that.
Guess we should turn it on. Yeah.
would help. Under the UV light box, we're able to highlight these areas of sun damage. We can see a lot more brown spots that we wouldn't normally see under visible light. These areas have been, just sun exposure throughout our years.
So are these reversible?
Somewhat. Definitely seeing a dermatologist and be able to pick up precancers and skin cancers is of utmost concern. But definitely, taking steps at this point to prevent ourselves from getting more sun damage, more sun exposure.
Yeah, no, you can come up, but she's healthy. She's fine.
Definitely, yeah.
And you look beautiful.
Thank you.
No. Okay, so give us some tips. Obviously, we want to put on the sunscreen, as Dan has always mentioned, and to reapply. But what are some of the other things we should be doing?
Sure. So I don't want people to be a hermit and just stay indoors and, just avoid the sun. We're in Hawaii. We got great weather here. Definitely avoiding peak hours when we're out in the sun. Using sunscreen, using sun protective clothing will go a long way to prevent sun damage and skin cancer.
Because there are some conditions like psoriasis and so forth that the sun actually can help, right?
Definitely, but wouldn't recommend somebody to just kind of go, sunbathing and just that increased risk in skin cancer.
All right, good stuff. Thanks, Doc. I appreciate it.
Thanks for having me.
Of course, we'll have more tips on our website, hawaiinewsnow.com. We'll be right back. You're watching Sunrise on Cable.